Hello everyone, I am Dr. Tahir. Welcome back to Youthful Medicine. Today I am going to discuss a challenging case that I saw earlier today, and it is quite a common problem for patients who are being treated with Zepbound or similar weight loss medicines, which are called the GLP-1 agonists. So one of my patients, he's about 48 years old, recently experienced severe constipation after I increased his medication of Zepbound from 5 milligram to 7.5 milligram. He hasn't had bowel movements in about 4 days, which can be quite uncomfortable. If you or someone you know who has been on weight loss medications such as Zepbound and has similar issue, you are not alone. And today I will explain why this happens and what can you do to manage it. So why does Zepbound cause constipation? Well, Zepbound is a GLP-1 receptor agonist, and while it helps with the weight loss by slowing the gastric emptying, meaning the food that stays in your stomach longer, it slows the emptying process. As the food is being crunched down in your stomach, after 30 minutes to an hour, it moves down. But in patients who are on Zepbound, their gastric emptying is slowed, and now it takes longer for their food to sit in their gastrointestinal system. And they also reduce your appetite. So you may not drink enough water, also thinking that you're not hungry or thirsty. This can lead to delayed gastric emptying, and bowel movements are slower. It reduces the movement of the food and the waste through the intestines, which can cause constipation. So now let's talk about how we can address it. Well, lifestyle modifications are always important when we are looking at the medications and their side effects. Our first intention is to make changes in our lifestyle so that we don't have to add another medicine to treat a side effect of the medicine, and that happens sometimes, unfortunately. First and foremost, simple lifestyle changes can impact your or it can solve this problem, and it can make a big difference. So increase your water intake. Staying well hydrated helps soften your stool and promotes regular bowel movements. Number two, increase fiber. Foods like fruits, vegetables, whole grains, they are rich in fiber, which can bulk up your stool and stimulate bowel activity. You could also consider taking a fiber supplement. And the third thing is increasing physical activity. If you're sitting too much and you're sedentary, your gut is actually become more slower to begin with. Now, regular exercise such as walking stimulates the muscles in your digestive system and can help move things along. Even yoga helps with that. Now, there are some over-the-counter options that you can consider which can help. If these adjustments, lifestyle don't work, you can consider some over-the-counter options. So I like using a term called bulk forming laxative, which is psyllium. It works great. It absorbs the water but in the intestines, making the stool easier to pass. Just remember to drink plenty of water when taking fiber supplements. And then another one is called osmotic laxatives. This is such as like Miralax, draws the water into the bowel and can provide short-term relief. These are usually safe, but should be used after discussion with your doctor, and maybe when you go see them, bring this up and so that they can give you a green signal. Now, for some stubborn cases, prescription medications may be needed, although I try to avoid as much as possible. And there are two options to consider. One is called Linzess, Linzess. Linactolide is the chemical name of the medication. This medication increases the fluid secretion in the intestines, and motility improves and helps, and it also speeds up the transit time. So Linzess increases fluid secretion in the intestines, and increases the transit speeds of the transit. So now the side effect of the Zepbound is being counteracted by another medication and making bowel movements easier and more regular. And I have some patients on it. Amitiza is my second option. Lupristor. Amitiza, Amitiza. Well, this works similarly by increasing this intestinal fluid and motility and helping relieve constipation. So both of these medicines are effective. They sometimes are expensive and your insurance may not cover it. So I suggest lifestyle and over-the-counter options before we have to go into medication. Sometimes they require prior authorizations. So another way is to reduce the dose of the Zepbound. In this case, my patient and we decided that since he was responding very well to 5 milligram dose and still losing weight about 3 to 4 pounds every month, I decided to decrease his dose rather than adding another medication. Another medicine or over-the-counter medication that I didn't mention yet is called stimulant laxatives, such as Dulcolax or Bisacodyl. They are another option for short-term relief, but should be carefully used because if you have gastrointestinal obstruction, giving a stimulant can actually cause damage to your intestines, and be very careful about it. They also have risk of dependency for long-term use. So lastly, if it is important that you and your doctor are working on and these medications are not helping, you may consider switching to another GLP medication. Final thoughts are that before you start a new medication such as Linzess or Amitiza, I would like to make sure that you review your medical history with your doctor and discuss any contraindications to medications, what can be done to maybe adjust the dose of the Zepbound or similar medications that you're using, and this way you can achieve a regular bowel movement. And lastly, I would like to say that I also incorporate a very good quality probiotic into your diet. Probiotics are really useful, and there are certain brands which are available and don't require refrigeration. One of them is called Doctor's Choice. It's available on Amazon, or a prescription one, or the one which requires refrigeration is called Vizbiome, Visbiome, Vizbiome, and that's also another important one. So I hope this information was helpful for you and it helped you manage your constipation, which is a common side effect with weight loss medication. And if you have found this video useful, please like it, subscribe to my channel, share it with a loved one, friend or family, so that they can also find some benefit out of it. And subscribe to my channel so that you can see topics that I discuss. As a rheumatologist in obesity medicine, my focus is on autoimmunity, inflammation, obesity, and ways to have a youthful life for you and for your loved ones. All right, until next time, take care of yourself. Bye.